This instrument is known as the G13-14. It's a debridement instrument, and specifically, it's a curette. It has a complex shank, meaning that it has bends and curves to help us access posterior areas of the mouth, and its shank is moderately flexible, meaning that it can remove light to moderate calculus. It's double-ended and paired, meaning that both ends of the instrument resemble one another. It has a semicircular cross-section and a rounded toe end, meaning that we can utilize this instrument subgingivally to remove subgingival deposits. It has a 70-degree angle from its face to terminal shank, and one usable cutting edge per working end. And we always want to utilize the lower cutting edge. One usable cutting edge per working end. This instrument is utilized in the posterior section of the mouth on all supra and subgingival surfaces. It's adapted from the distal line angle to the distal interproximal space. So we're going to start at the distal line angle, and basically we're just going to turn a little corner into the distal interproximal space. That's it. Start at the distal line angle, turning the corner. A little trick to help us remember which working end to use when using the 13-14 is we always want the bump out, away from the tooth. So right now we have the bump and it's out, away from the tooth. This way it assures us that once we go interproximally, the terminal shank will be parallel with the long axis of the tooth. If the bump was in towards the tooth, we wouldn't be parallel. So I know it's kind of hard to see, but see how that's not parallel when the bump is in? Yet if we have the bump out, whenever we move the instrument to interproximal space, we'll be parallel. So remember, 13-14, bump out, and that will help us always be parallel with the long axis of the tooth. Now we will see this instrument used clinically.
So 13-14 is going to be from distal line angle to distal interproximal. So starting at the distal line angle. If you're working on mandibular toward surfaces, you're going to be seated 9 o'clock towards the front seating zone. Patient will be turned away from you. Okay, so 13-14 on the maxillary right toward surface, identifying the correct working end by placing the instrument the distal interproximal. The terminal shank should be parallel to the long axis of the tooth, and when you begin your instrumentation sequence, the terminal bend in that shank should be away from the tooth surface. Maxillary left lingual. Toward surface, seated in the front seating zone towards the 9 o'clock seating position, cupping under the patient's chin. Maxillary away surfaces, you'll be seated at approximately 11 o'clock seating zone. Utilizing indirect vision, starting distal line angles, distal and proximal.